Sanjay Gupta, MD, CNN Saturday and Sunday mornings, 7:30 Eastern.
The man behind Apple Computer, Steve Jobs, you've heard this now, he's stepping down and said this: "I've always said if there came a day when I could no longer meet my duties and expectations as Apple CEO, I would be the first to let you know. Unfortunately, that day has come." It's a sad statement for sure. He did not mention his health specifically, but in 2003, he was diagnosed with a rare type of pancreatic cancer. A year later, he had surgery, an operation to remove it. In 2009, he needed a liver transplant. It raises a lot of questions. Joining me now is Dr. David Kuby from Emory University, a surgeon that treats these sorts of problems. I'm sure, like a lot of doctors, and you, as a specialist in this area, have been following the story of Steve Jobs for some time. What were some of your first thoughts when you heard this?
Well, my impressions were that obviously something has changed in his health status, and whether I cannot speculate specifically on Mr. Jobs' case, as I am not one of his treating physicians, but either he's having a problem with his liver, or disease has progressed, or something that has caused him to go down this road.
Yeah, and in the past he's taken medical leaves that have been extended, but this time he said, the day has come when I can no longer do my job. So what exactly that means, like you said, it's hard to speculate. But we're talking about a rare type of pancreatic cancer. Pancreatic cancer is a pretty terrible disease, tough one to treat. What about this rare type of pancreatic cancer?
Yeah, I think that's an important point, Sanjay. I think people out in the community might think that this is the same type of disease that Patrick Swayze died from, which was pancreatic adenocarcinoma. This is a far less common type of tumor. It's poorly understood. It arises from different cells in the pancreas, and it can cause all types of different syndromes. People can either do very well with it, or they can go down a bad road and die quickly from it. Mr. Jobs' case is pretty typical. It might start in the pancreas and spread. About half the people will actually have disease that has spread by the time they're diagnosed.
When they actually... He describes, he got a biopsy for this because they had seen some sort of mass in his pancreas, and when they saw the results of the biopsy, he says the doctors literally were in tears because they said, "Oh, this is so much better than the very, terrible sort of diagnosis." Obviously, no two patients are the same, but this could have been cured potentially at the time?
Well, again, I can't speculate on his particular case. In some situations, we do find the tumors early enough that we can put people in the category of what I like to use the word is durable remission, possibly cured. You never know if you're cured from cancer unless you die of something else before the cancer shows up again.
Right, sure.
So in his particular case, it's hard to say what was going on, but yes, that is the typical reaction. When a biopsy is done and the concern is pancreatic adenocarcinoma and it comes back pancreatic neuroendocrine tumor or neuroendocrine cancer, that is a more favorable diagnosis.
With someone like him, I mean, if you have all these various treatment options, a liver transplant was something that was put on the table. Why would a liver transplant help cancer of the pancreas?
So one of the analogies we'll use, or a way to think about it, is not all cancers behave the same. So in one circumstance, a person with one type of tumor that spreads to the liver might be a candidate to have a portion of the liver removed or the whole liver removed in order to get them to a better place, or offer them potential survival advantage. And for other types, even a small spot spreads to the liver, wouldn't even consider it. This type of tumor, yeah, if for a small subset of patients, if the disease is only in the liver, has not spread anywhere else, and the person's done well for a long period of time, it can be considered. Having said that, it is not done often.
And we're talking about, again, a rare type of cancer in the first place. Final question, and again, we don't know the specifics of Steve Jobs' case, but what is life like for somebody who has this type of tumor, who undergoes the treatments for it? I mean, how debilitating is all of that? It
really depends on the stage at which it's diagnosed, what therapy they undergo, and what stage of the disease they are actively in. So in his particular case, I would imagine he's not feeling very good, and that's why he had to step down from his functional role. But other patients have a terrific life expectancy and do quite well and are quite productive.
Thanks for joining us. It's sad, I mean, you read the statement, no matter what you know about this, this titan saying, look, that day has come, we have to step down. I guess it will happen to all of us at some point or another. Dr. Kuby, thanks so much.
Thank you so much.